The physiology of the endocrine system, the pancreas. The pancreas is a long, slender organ, most of which is located posterior to the bottom half of the stomach. Although it is primarily an exocrine gland, secreting a variety of digestive enzymes, the pancreas has an endocrine function. Its pancreatic islets, clusters of cells formerly known as the islets of Langerhans, secrete the hormones glucagon, insulin, somatostatin, and pancreatic polypeptide. The cells and secretions of the pancreatic islets. The pancreatic islets each contain 4 varieties of cells. The alpha cell produces the hormone glucagon and makes up approximately 20% of each islet. Glucagon plays an important role in blood glucose regulation. Low blood levels stimulate its release. The beta cell produces the hormone insulin and makes up approximately 75% of each islet. Elevated blood glucose levels stimulate the release of insulin. The delta cell accounts for 4% of the islet cells and secretes the peptide hormone somatostatin. Recall that somatostatin is also released by the hypothalamus as GHIH, and the stomach and intestines also secrete it. An inhibiting hormone, pancreatic somatostatin, inhibits the release of both glucagon and insulin. The PP cell accounts for about 1% of islet cells and secretes the pancreatic polypeptide hormone. It is thought to play a role in appetite as well as in the regulation of pancreatic, exocrine, and endocrine secretions. Pancreatic polypeptide released following a meal may reduce further food consumption. However, it is also released in response to fasting. Regulation of blood glucose levels by insulin and glucagon. Glucose is required for cellular respiration and is the preferred fuel for all body cells. The body derives glucose from the breakdown of the carbohydrate-containing foods and drinks we consume. Glucose not immediately taken up by cells for fuel can be stored by the liver and muscles as glycogen, or converted to triglycerides and stored as the adipose tissue. Hormones regulate both the storage and the utilization of glucose as required. Receptors located in the pancreas sense blood glucose levels, and subsequently the pancreatic cells secrete glucagon or insulin to maintain normal levels. Gonadal glands. The male testes and female ovaries, which produce the sex cells, sperm and ova, and secrete the gonadal hormones, the roles of the gonadotropins, released from the anterior pituitary, the FSH and LH, were discussed earlier. The primary hormone produced by the male testes is testosterone, a steroid hormone important in the development of the male reproductive system, the maturation of sperm cells, and the development of male secondary sex characteristics such as a deepened voice, body hair, and increased muscle mass. Interestingly, testosterone is also produced in the female ovaries, but at a much reduced level. In addition, the testes produce the peptide hormone inhibin, which inhibits the secretion of FSH from the anterior pituitary gland. FSH stimulates spermatogenesis. The primary hormones produced by the ovaries are estrogens, which include estradiol, estriol, and estrone. Estrogens play an important role in larger number of physiological processes, including the development of the female reproductive system, regulation of the menstrual cycle, the development of female secondary sex characteristics such as increased adipose tissue, and the development of breast tissue, and the maintenance of pregnancy. Another significant ovarian hormone is progesterone, which contributes to regulation of the menstrual cycle and is important in preparing the body for pregnancy, as well as maintaining pregnancy. In addition, the granulosal cells of the ovarian follicles produce inhibin, which, as in males, inhibits the secretion of FSH. During the initial stages of pregnancy, an organ called the placenta develops within the uterus. The placenta supplies oxygen and nutrients to the fetus, excretes waste products, and produces and secretes estrogens and progesterone. The placenta produces human chorionic gonadotropin, the HCG, human chorionic gonadotropin hormone, promotes progesterone synthesis and reduces the mother's immune function to protect the fetus from immune rejection. It also secretes human placental lactogen, or HPL, which plays a role in preparing the breast for lactation, and relaxin, which is thought to help soften and widen the pubic symphysis in preparation for childbirth. Some diseases and disorders of the endocrine system. Acromegaly is a disorder in adults caused when abnormally high levels of growth hormone trigger growth of bones in the hands, face, and feet. Addison's disease is a rare disorder that causes low blood glucose levels and low blood sodium levels. The signs and symptoms of Addison's disease are vague and are typical of other disorders as well, making diagnosis difficult. They may include general weakness, abdominal pain, weight loss, nausea, vomiting, sweating, and cravings for salty food. Cushing's disease, a disorder characterized by high blood glucose levels and the accumulation of lipid deposits on the face and neck. It is caused by hypersecretion of cortisol. The most common source of Cushing's disease is a pituitary tumor that secretes cortisol or ACTH in abnormally high amounts. Gigantism is a disorder in children caused when abnormally high levels of growth hormone prompt excessive growth in the body. Hirsutism. Hirsutism is a symptom of an excessive production of androgens, causing hair growth in women where they typically do not have hair growth. While some medications may cause the increased androgen production, it can also be linked to endocrine disorders such as polycystic ovary syndrome, or PCOS, Cushing's syndrome, and tumors in the ovaries or adrenal glands. Hyperthyroidism, a condition marked by high levels of thyroid hormones that result in weight loss, profuse sweating, and increased heart rate. Hypothyroidism, a condition marked by low levels of thyroid hormones that result in weight gain, cold sensitivity, and reduced mental activity. Graves' disease, a condition marked by a disorder of the thyroid gland resulting in hyperthyroidism. Diabetes insipidus, a condition caused by a lack of or hyposecretion of the antidiuretic hormone ADH. The condition can also be caused by the failure of the kidneys to respond to ADH. Diabetes mellitus, a condition marked by a disorder of the pancreas resulting in high levels of glucose in the blood.